A new study suggests that constant nudges from Indian Prime Minister Narendra Modi and the Indian government helped the country tackle the coronavirus on several fronts. India has reported over 5.2 million cases and well over 82,000 deaths, making the country one of the worst hit in the world. However, according to the authors of the study, an even greater tragedy may have unfolded if the Prime Minister and the Indian government had not nudged the citizens to maintain one of the strictest and longest lockdowns in the first quarter of the year. Indian Prime Minister Modi's frequent public appearances proved to be one of the most significant factors that pushed a multi-sectoral change. Now, the study suggests that these nudges help keep the country of 1.3 billion people adhering to the strict lockdowns and wearing masks. Now, published in the science journal PLOS, one of the studies used the machine learning and AI-based algorithms to identify policy decisions across government departments to deal with the coronavirus pandemic. Now, according to the study, India nudged across 14 key policy areas that influence the 1.3 billion strong population to maintain social distancing and COVID-19 norms. The Indian government also nudged to tackle fake news about the virus and convince the population to strictly adhere to social distancing norms. One of the first nudges came around January when the government focused on evaluating the risk of incoming passengers travelling from China. The government began surveillance in the international airports, and the researchers believe that the benefits of this nudge campaign are still being felt, despite the record surges in the cases. Now, according to researchers, the study tries to understand how nudges were invented through policy interventions in order to fight the coronavirus outbreak. According to the authors of this study, Modi's public assurances nudged in creating the hard effect across pharma, economic, health and public safety sectors that enabled the strict national lockdown. Now, our London Bureau Chief, Mandy Clark, spoke to both of the authors of the study, Dr. Ronita Bardhan, who is a lecturer and a fellow at Selwyn College, and Ramit Debnat, who is a co-author. Listen in.
India is a very diverse country, so a nudge which works for one particular community might not work for the other, might be completely irrelevant. So that is another thing. To create a nudge to bind 1.3 billion population together is a very difficult challenge, and make everybody behave in the similar fashion is also a very difficult challenge. So I can say one of the success of the nudges is that even today, when India is, I think, in unlock 4.0, which is like unlock phase where almost every economic functions are working apart from certain industries and certain sectors, people are wearing masks. Obviously, they are all carrying sanitizers. So that's a big success in terms of, I think, earlier in the stages when you start creating these nudges.
In India, a lot of the nudge theory happened in many layers, and it worked across different sectors of the ministries. So some ministries which were at the forefront, like the Ministry of Civil Aviation and Health, they had to nudge a lot of people to adhere to the new norms which were being built in terms of restricting travel and then maintaining safe distance within the airports. But it was the phase when it was not the lockdown. But after lockdown, this dialogues changed very fast, and the nudges as well. So it was quite challenging because there are many people in India, as you know. So 1.3 billion people, and to convince them across different diverse group was a lot of tough task, and it was a big challenge.